Managing high blood pressure, hypertension, involves lifestyle changes and, in some cases, medication. Here are some key strategies. Rule 1: Lifestyle changes. Dietary modifications. Reduce salt intake. Aim to consume less than 2,300 mg of sodium per day. Lowering it to 1,500 mg is even better. Eat a balanced diet. Focus on fruits, vegetables, whole grains, and lean proteins. The dietary approaches to stop hypertension. Diet is highly recommended. Limit alcohol. Drink in moderation, up to 1 drink per day for women and 2 drinks per day for men. Exercise regularly. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous exercise per week. Maintain a healthy weight. Losing even a small amount of weight can help reduce blood pressure if you are overweight or obese. Avoid tobacco. Smoking raises blood pressure and damages blood vessels. Quitting smoking can improve overall health. Reduce stress. Practice relaxation techniques such as deep breathing, meditation, yoga, or Tai Chi. Rule 2: Medical management. Medications. Your doctor may prescribe medications such as diuretics, ACE inhibitors, calcium channel blockers, or beta blockers. It's crucial to take medications as prescribed. Regular monitoring. Monitor your blood pressure at home and have regular checkups with your doctor. Rule 3: Additional tips. Limit caffeine. Caffeine can temporarily raise blood pressure, so it's a good idea to limit its intake. Get adequate sleep. Poor sleep can contribute to high blood pressure. Aim for 7–8 hours of quality sleep each night. Monitor and manage other health conditions. Conditions such as diabetes and high cholesterol can affect blood pressure. Managing these conditions can help control blood pressure. Natural remedies. Increase potassium intake. Potassium helps balance sodium levels in your body. Foods rich in potassium include bananas, potatoes, and leafy greens. Garlic. Some studies suggest garlic supplements can help lower blood pressure. Hibiscus tea. Drinking hibiscus tea has been shown to help lower blood pressure in some individuals. Rule 4: Regular checkups. 1. See your doctor regularly. Regular visits to your healthcare provider can help keep track of your blood pressure and adjust treatments as necessary. Emergency situations. 1. Recognize hypertensive crisis. If your blood pressure suddenly exceeds 180/120ths of a millimeter Hg, seek immediate medical attention. By integrating these strategies into your daily routine, you can effectively manage high blood pressure and reduce the risk of complications such as heart disease and stroke.